All right, my friends, today we're reacting to Dr. Mike and a few other doctors giving their hottest medical takes. I don't actually agree with all of them. And at the end of the video, we're gonna go over this caption contest. You guys had some fire and roasted me, and we'll decide the winner at the end of the video. So let's dive in.
I asked 20 doctors to give me their hottest take about medicine. I'll go first. Cold plunges are incredibly overrated and bordering on useless. There's no great real life data that shows benefit, let alone if people actually stick to these things long term. All these podcast hosts and experts coming out and talking about research, they're talking about fringe research that doesn't include real life examples of improvement to justify spending $3,000 to $5,000 for these specialized cold tub plunges when there's actually some research coming out that's legitimate showing that cold water immersion doesn't even help with sore muscles, let alone all the other miracle promises out there.
I'm going to disagree with Dr. Mike on this one. First of all, $3,000 to $5,000 for a really nice cold plunge is not necessary to first experiment with this. What I've done is gone to a gas station, got a couple bags of ice, and put it in a tub, and then boom, problem solved, super cheap. Now, in terms of research, this 2022 meta-analysis found that cold exposure is a highly effective recovery tool after high intensity exercise and endurance training. And more specifically, they had better outcomes for muscle power 24 hours after exercise, as well as the perceived recovery, and of course, decreased muscle soreness, or DOMS, delayed onset muscle soreness. There's also this 2020 study that shows cold exposure led to increases of norepinephrine by over 500% and dopamine by 250%. And these neurotransmitter changes are thought to be the main drivers of the mood elevating and stabilizing effects of cold therapy. Also helps with focus and attention. And of course, this has huge implications for mood disorders, depression, etc. Now, adding to that, there's this 2020 randomized controlled trial, and they had two groups. Experimental group did cryo at a proper temperature 5 times a week for 2 weeks, and the control did essentially a mild cryo. It wasn't cold enough to be considered true cold therapy, but they also did that 5 days a week for 2 weeks. And they found a statistically significant difference in terms of the depression assessment results between the two groups. Now, in addition, you're building resilience and grit. You're enhancing the top-down control you have of your nervous system over those more reflexive and automatic states. With top-down control, I'm referring to the prefrontal cortex. That's your executive function of the brain, helps with planning and suppressing impulsivity. So cold exposure is helping you train the mind in a way. And the last thing I want to say is it actually helps with your circadian rhythm. So as you get closer to bedtime, you want to cool your body, and when you first wake, you want to warm your body. And when you do cold therapy, your body reflexively warms up. So it's actually good to do earlier in the day. You don't want to do it close to bedtime for that reason, because you're going to warm your body. But it's another tool to help with circadian rhythm.
We need to better understand and study medical marijuana.
Oh, absolutely. By the way, for those who don't know, when I was in college, I think I may have touched marijuana like 2 or 3 times before applying to med school. And then after getting accepted to a few programs, then I was like, all right, time for me to properly enjoy my college experience. And I took this class called Neuropharmacology of Drugs of Abuse. One of the coolest classes. That and History of Music were like my 2 favorite classes in college. I also partook in frequent marijuana use at the time. And my big project for the class at the very end, like it's your final, was all about marijuana, the research we have, why it should be legalized, the medical uses, etc.
Respect the family and back off.
And there is no data-backed reason for any child to ever see a chiropractor.
Most physicians are very cautious about chiropractic manipulation because in medical school, we hear a lot of cases of things like vertebral artery bilateral dissection causing a stroke after neck manipulation. So it's not without its risks.
Scrotum is the ugliest part of the body. There was a study in the Journal of Cosmetic Dermatology where they surveyed men and women. They had them look at various scrotum, or scroti, is it scroti? And they had them rank these scrotums on a scale of -3 to +3. -3 being the least attractive and +3 being the most attractive. Well, every single scrotum was given a negative score, so none of them were actually considered attractive.
And that's why we have aesthetic plastic surgeons to help make our scrotums beautiful.
That probiotics are useless for the average person.
Probiotics companies are taking advantage of people.
It's more hype than health, and if you're taking probiotics, there's a good chance all it does is make your feces more expensive. Now, there is some evidence that it does work and provide some clinical benefit for people with a narrow range of conditions.
I'm actually one of those people. So I have Crohn's colitis. It's like a hybrid between Crohn's disease and ulcerative colitis. So essentially think of Crohn's disease pattern restricted to the colon. And there is one probiotic that has evidence to suggest it helps maintain remission in those that have ulcerative colitis. So I've been taking that probiotic for years. It's expensive. I drop like $100 every single month on it. It's like $3 a day. So I have one of those conditions, but there are other probiotics that are pretty cool. Like there's one that I'm experimenting with right now that actually helps blunt your blood sugar when you eat foods that maybe aren't the healthiest from a metabolic perspective. Video on that coming shortly.
In general, resident doctors in this country are not given an adequate time to sleep and recover in training, and as a result, they suffer, and patient care can suffer too. Today, it is still legal and accepted for resident doctors to work up to 28 hours in a shift. I mean, research has found that sleep deprivation can cause physiological impairment in our bodies that actually mimics the effect of alcohol intoxication. Being awake for 24 hours straight is similar to having a blood alcohol content of 0.1, which is above the legal limit to drive. If it's not safe for resident doctors to operate a vehicle, why would it be safe for us to operate on or treat a patient?
Yeah, well said. I've actually talked about this previously a few times about the whole BAC to sleep deprivation comparison. And I remember one shift back when I was in residency, I was awake for more than 30 hours. I think it was maybe like 32 hours. And I was starving, of course, because you couldn't eat when you're busy running around the hospital. So I pick up some Thai food, and in the parking lot, I'm reversing, and I almost hit a stationary car. And at that moment, I mean, the first thing is like, this is wrong. We shouldn't have to be awake for 30 plus hours. But I'm obviously not going to be able to change the system overnight. So what I promised myself then is that I will always Uber home after a really long overnight shift and not drive to minimize the risk associated with that.
Our medical system is set up to fix problems in the doctor's office or in the operating room. But there's only so much that we can do when we're living in an unhealthy society. I believe people need to take more ownership of their health, and that society needs to enable them to make healthy decisions.
Really well said. I think in the West, a lot of us feel that we can go to the doctor with any problem, and the doctor should be able to prescribe the magic pill that solves our problem. And I've had this conversation with some relatives where they say, this doctor wasn't good because they couldn't control my blood pressure or my cholesterol based on these meds, and we had to try all these different meds, and even then it only helped a little bit and not enough. And I told them, well, first of all, there is a progression to which medication you want to try. So for me, as an example, I'm on pravastatin, which tends to be better tolerated, and then if I don't see the results I want, then I can go to other medications. But the main point I'm trying to get at is, if they focus on lifestyle factors, things like diet and exercise primarily, but also some other things like sleep and stress, etc., then they might not even need those medications at all.
My name is Ricky Brown, and I am a board-certified plastic surgeon in Scottsdale, Arizona. My hottest take is that everyone in the world thinks that what we do as plastic surgeons is what is portrayed by Hollywood or the Kardashians. That couldn't be further from the truth. People always forget we also do tons of reconstructive work like cleft palates and cleft lips and cancer reconstruction.
I think the reconstructive work is almost like science fiction because it gets very complex. You're working with neurosurgeons and orthopedic surgeons and plastic surgeons all together. And some of the things that we can do today, I remember when I first saw it rotating as a medical student, I thought it was straight science fiction, pinch me, I'm dreaming kind of stuff. It's really amazing. I wish that reconstructive plastic surgery got more attention because I think it really deserves it.
I'm Dr. Dana Brams, and I'm a podiatrist, which is a foot and ankle specialist and surgeon. Speaking in too much medical jargon is not good for patients. I think that if you can't explain things in a way that people understand, then maybe you don't understand it yourself.
The first thing I thought of when she said that was when I would get massages and I was dating this girl who was also in med school, we would just use like anatomical terms of like superior, inferior, lateral, medial, which is hella nerdy, but it worked well. All right, so caption contest winners. When Susan, CEO of YouTube, says you can no longer mention in your videos that you mashed into plastics. That's good, man. I deserve that. I deserve that. I am also going to defend myself by saying that when it comes to the internet, you have to remember that people are constantly coming to your channel that are new. Most people that are watching your popular videos they're not subscribed, right? So you want to establish credibility, and that's why I do it. Sarah Mahudin, you and your parents looking at your credit card bill after med school applications. Med school apps are expensive. Wait until you get to med school as well. The tuition is insane. Ronald Raman Henkel, when you taste alcohol for the first time. Dude, to this day, I still do not like beer. I only enjoy whiskey, sake, wine, and some tequilas. Raised in California, 1828. The 250-pound fighter when he has to get a shot in the ED. That's funny. It reminds me of orientation week in med school, all these icebreaker activities and also educational activities, such as, I think it was either drawing blood or starting an IV in your classmates. And one of the guys that, I mean, he wasn't like a huge dude or anything, but he was very much like posturing, like, yo, I'm some like cool, tough guy. He got super pale and almost fainted, which I thought was a little bit ironic. That's it, my friends. Much love. See you in the next one.